She blames one of my favorite desserts, cheesecake, for helping her pack on the pounds during pregnancy. Now Pink is opening up about her weight loss struggles.
Well, a lot of people can relate. So in today's edition of Doc Hollywood, I sat down with Dr. David Caccamo, a primary physician at HealthPartners Clinics, to find out how, like Pink, you too can drop the lbs. Okay, Dr. Caccamo, let's talk a little bit about Pink. Good for her. She was recently on the cover of Shape magazine, lost 55 pounds. She'd gained it while she was pregnant. She says it was the candy and the desserts, the key lime pie, that did her in. Okay, so if someone wants to lose 35, 40, 55 pounds, what's the advice you want to start them off with?
It's a great question because I think a lot of us have experience with trying to lose weight and failing. So, we all know that you got to burn off more energy than you take in, but how do you do that? So one key technique is to limit portion size. The typical portion size in restaurants now is about twice as big as it was a couple of decades ago.
Yeah.
Decreasing your portion size from the start allows you to get less full by the time you even realize what you've eaten. One key thing is to write it down. There's been study after study that showed when they record everything they put in their mouth, they lose weight better. You can keep a journal, you can write it down on paper. There's online tools that you can use, and there's even apps for that.
We've all seen really how great Alec Baldwin looks. He decided to lose 35 pounds because he learned that he was pre-diabetic. He didn't lose weight just to look good. He wanted to be healthy. Tell us a little bit about being pre-diabetic. What does that mean?
Prediabetes refers to when there's been a change in the metabolism of the body and the blood sugar goes up. So the blood sugar is higher than it is normally, but it's not to the level that we see in diabetes. It's certainly an important wake-up call. We know that for people with prediabetes, the important things to do are get moving, increase your physical activity, often losing weight, and it helps to learn something about how to eat and what to eat. We know that about 50% of people with prediabetes will go on to get diabetes, and so it's really an important time to take some action to try to prevent that progression.
Well, this celebrity became very controversial, Paula Deen. She now has lost 40 pounds and is embracing some diabetes-friendly type of foods because she had that type 2 diabetes diagnosis. What are some of the lifestyle changes that people with type 2 diabetes need to make?
Diabetes affects so many different parts of your life, and we know that people who learn about their diabetes and know how to handle it do better.
I know there are a lot of diabetes medications that can really help. You always kind of wonder, do people rely too much on that idea? Oh, I can just take a pill and not have to do the other work.
The physical activity and the nutrition being a medication, that's a treatment too. To whatever degree you can not need medications, that's great.
Yeah.
Wonderful that we have them and that they work, but you also want to be using those other treatments as best you can too.
All right, so Doc, what's the one thing that people often forget about when they're trying to lose weight?
One thing people often forget is to be especially careful about the little things. The candy in the desk drawer, the brownies in the break room.
It's tiny though. It's just a little bite. What are you talking about?
Those couple hundred calories can mean the difference between being stuck or getting moving again, so pay attention.
All right, thanks so much. Great advice today. We really appreciate it.
Thank you.
You kind of ruined the candy drawer for me, but it does make a little bit of sense. You can head to TwinCitiesLive.com to vote for next week's Doc Hollywood topic. Just click on Only on TCL. We want to thank HealthPartners Clinics and Regions Hospital for sponsoring the show. And remember to check with your physician if you have any kind of health concern. We got more TCL coming up next.